For primary, the main cause, like 85% of the time, is something called a parathyroid adenoma.
Right, an adenoma. It's basically a benign tumor, so not cancer, usually just on one of the 4 parathyroid glands.
It's just one gland, usually.
Yeah, usually. But there are other causes too, though they're less common for primary HPT. You can have hypoplasia, which is where all 4 glands get bigger and overactive. That's maybe 10-15% of cases. Sometimes you see that with certain genetic syndromes like MenM, multiple endocrine neoplasia. And then really rarely, less than 1%, you can have parathyroid carcinoma, which is actually cancer. That's much more aggressive.
Okay, so that's what can go wrong. But the how is really interesting too. How does too much PTH actually raise your calcium levels?
Right, so PTH is like the main regulator for calcium. It pushes calcium levels up in a few key ways. First, it tells these cells in your bones, called osteoclasts, to basically break down bone tissue and release calcium into the blood. So it's literally pulling calcium from your bones.
Mining the bones for calcium, wow.
Exactly. Second, it acts on your kidneys. It makes them reabsorb more calcium, so you pee less of it out. And third, it boosts the activation of vitamin D, specifically the 1025-dihydroxyvitamin D form. And that active vitamin D then makes your intestines absorb a lot more calcium from the food you eat.
And it's worth noting too, while it's doing all that calcium boosting, PTH also tells the kidneys to get rid of phosphate. So in primary HPT, phosphate levels might actually be low or maybe low normal.
Correct.